Hello everyone, welcome back to our channel Let's Talk Genetic Counseling, where we discuss important aspects of genetics to increase awareness about it. This is part 1 of 5-part series where we'll discuss about important aspects of genetic counseling in the field of preconception, prenatal, pediatric, cancer, and adult onset genetic conditions. Today, we are diving deep into preconception and prenatal aspects of genetic counseling, and we will explore what it is, why is it important, and who benefits from it, especially in Indian scenario. So let's get started. My name is Kishore Sai. I am a genetic counselor from Hyderabad. If you would like to take an appointment with me, you can do so by clicking in the link in the description and also in our bio. First of all, let's discuss what is preconceptional genetic counseling. Preconceptional genetic counseling provides individuals or couples with vital information and support associated with potential genetic risks associated with having children. It's an empowering tool to make informed decisions about family planning. Now, let's discuss the indications to meet a genetic counselor. The first indication would be carrier screening. What carrier screening basically means is it tests individuals for specific genetic conditions that they might be carrier for and potentially pass on to their children. Carrier screening is particularly crucial in preventing the transmission of genetic conditions that might be more common in certain populations. This is relevant across various communities in our country. How it works is carrier screening requires a simple blood test, and if both parents are carrier for a specific genetic condition, then there might be 25% chance for their child to have the genetic condition. And in X-linked conditions, it is more important because females can be silent carriers for it. This means they carry the gene in one of the X chromosome but usually do not show symptoms for it. However, they can pass it on to their sons who might be affected with it and their daughters who might be carrier like them. An example is hemophilia, which is called royal disease. If you do know why is it called a royal disease, please mention it in the comments and we will reply to your comments soon. The next indication would be personal or family history of genetic disorders. This involves understanding the genetic conditions present in the family. It is important because knowing the family medical history can help us predicting the likelihood of genetic disorders in the family. For instance, if there is a known genetic disorder in the family, then testing the prospective parents can help us understand the risk for their children. If there is this indication, your genetic counselor will take detailed family history followed by genetic testing to provide risk assessment and any reproductive options if necessary. The next indication would be previous pregnancy with a genetic condition. This is for couples who have had a child previously with genetic disorders or birth defects. It helps us understand the risk of recurrence for future pregnancies. Conditions such as intellectual disabilities or structural abnormalities require a well-detailed genetic counseling session. During this process, genetic testing and detailed medical history analysis helps us assess the risk and provide guidance on managing future pregnancies. The next indication would be consanguinity. Consanguinity means the marriage between relatives such as first cousins, which is common in many parts of our country. It is important because these couples have higher chance of passing on genetic disorders due to shared ancestry. Genetic counseling helps us understand specific risks and provide future family planning options. Your counselor may offer a genetic test to you before the conception and discuss strategies to mitigate the risk. The next indication would be advanced maternal age. Women who are above 35 years of age will come under this indication. It is important because advanced maternal age increases the risk for chromosomal abnormalities like Down syndrome. Your genetic counselor might discuss prenatal testing options such as amniocentesis or chorionic villus samplings to assess and diagnose potential chromosomal abnormalities early in the pregnancies. The next indication would be reproductive challenges. Couples who have experienced recurrent pregnancy losses or reproductive challenges will be considered for this indication. It is important because understanding potential genetic factors can help them find solution and improve the successful outcome of pregnancy. Your genetic counselor might explore potential genetic causes and discuss options like assisted reproductive technologies. For example, if genetic testing reveals a specific cause, then Pre-implantation genetic diagnosis followed by in vitro fertilization can be helpful. If you would like to, we can discuss about prenatal genetic diagnosis in our future upcoming videos. Do mention it in our comments below. Genetic counseling provides us with crucial information and empowers individuals and couples to make informed decisions. In India, this service is becoming more important as the awareness is growing.
Hi everyone. So, as my friend Kishore already discussed about preconceptional genetic counseling and its importance, now I will be discussing about what is prenatal genetic counseling and the scenarios where you will be referred for genetic evaluation during the prenatal period. So, what is prenatal genetic counseling? A genetic counseling which is sought during the prenatal period, that is basically when the woman is pregnant and they are referred for genetic evaluation. This is known as prenatal genetic counseling. So, we will be discussing about what all are the scenarios or the indications during the prenatal period to meet a genetics professional. So, the first and very common scenario that we see is the abnormal ultrasound findings during pregnancy. So, we might be knowing that during a pregnancy, there are 4 compulsory ultrasound scans that has to be performed. So, first is the confirmatory scan, pregnancy confirmation scan, which is usually between 6 to 7 weeks of gestation. Second is an NT&B scan, that is during 11 to 13 weeks of gestation. And you have a targeted anomaly scan, which is performed in the 19 weeks of gestation. And then a growth scan, which is performed in 7th or 8th month of pregnancy. These are the compulsory scans, but depending on the features that you see in the fetus and depending on the maternal conditions, the number of scans may increase also. So, as I said, the first indication is an abnormal ultrasound scan. So, during the NT&B scan, there is chance of identifying soft markers, and also during the 19-week scan, which is a targeted anomaly scan, we will be focusing more on structural malformations in the fetus. So, if such malformations or soft markers are identified by ultrasonography during pregnancy, this is an indication for referral to a genetics clinic. This is because these structural malformations or more than 2 soft markers, identification of more than 2 soft markers may be associated with a genetic risks. For example, it may be associated with a chromosomal condition. So such risks has to be explained, and the pros and cons of going for further genetic evaluation by prenatal invasive testing has to be discussed with the family. So understanding and giving proper management and intervention options is necessary. So this is the first and very common indication, that is abnormal findings are found by ultrasonography. You will be referred for genetic evaluation, and in the genetics clinic, the genetics professional will discuss with you what is actually identified and what are the risks associated with it, and what is is there a possibility for a genetic condition. Now the third indication is parents or the couple being carrier for a genetic condition. So, as discussed in the previous section in the preconceptional counseling, you will get an option to identify if you are carriers, like carrier status of the couple before planning pregnancy also. But sometimes we often see that the couple comes after conceiving and then give a history that the previous child is affected with a probable genetic condition but not worked up. So, if the carrier screening is done during pregnancy, you will get the report of it during pregnancy, and that counseling will be given during the prenatal period. So, that is also prenatal genetic counseling. So, in conclusion, there are the preconceptional counseling. When comparing preconceptional and prenatal counseling, whatever is possible to do during the preconceptional period, it is always better, and it is always advisable to do preconceptional genetic counseling wherever possible. For example, if you have a family history or you had a previous pregnancy affected with a genetic condition, it is always advisable to not wait till the prenatal period. That is, do all the workup and complete before planning pregnancy, so that you will understand the risk associated with it, and also you have time for further workup. I hope this video finds helpful for you, and if it does, please do share and subscribe. And thanks for watching. Let's talk genetic counseling because our genes matter. Thank you.